I should make a video about how to get more sleep so that other people can enjoy doing exactly what I'm doing right now. Let's do it. Oh, hey guys, this is Dr. Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. And something that's told me to make a video about how to get more sleep. So I guess that's what I'm going to do right now. So stay tuned. If you're enjoying the video so far and would like to see more breakdowns from me on important medical topics, make sure you hit the button down below and subscribe to Trust PCP. So let's start off by discussing why sleep is so important. Sure, if you don't get enough of it, you're going to be all groggy and grumpy and probably snap at the first person to say anything wrong to you in the morning. But beyond this, there's actually a lot more at stake. Over the years, we've been able to connect a lack of sleep to the development of many dangerous diseases like heart disease, stroke, high blood pressure, diabetes, obesity, depression, and substance abuse. In addition, the lack of sleep can increase the risk for accidents, suicide, and death from all causes. So if you're not sleeping well, you definitely want to keep watching to find out how to get more high quality sleep. Now, tip number 1 is to leave the smartphones, tablets, laptops, and TVs alone at least 1 hour before bedtime. I say this because these screens expose us to a specific type of visible light called blue light. And what this light does is that it shuts down the production of a hormone in our body called melatonin, which we usually make at nighttime to tell us that it's time to go to sleep. There's a lot of research going on right now studying the effects of blue light, and companies have developed glasses to help shield you from it and apps to help protect you from it when you look at screens. So we'll know more in the next few years, but one thing that's clear for now is that if you sit there and stare at your smartphone for an extended period of time before going to bed, it's going to prevent you from getting the best sleep possible. Now, tip number 2 is if you're not sleepy or if you have difficulty sleeping, get out of bed. Don't just lay there in bed and wait to get sleepy, because if you do that, you're just going to overthink things and maybe even develop some anxiety about not being able to go to sleep. Give it about 20 or 30 minutes at the very most, and if you haven't fallen asleep, get up and go do something relaxing like read a book, listen to some relaxing music, or maybe even meditate. And if you start to feel sleepy a little bit, then you can try to go back to bed and fall asleep. If 20 or 30 minutes go by again and you still haven't fallen asleep, then get up and repeat the cycle over again until you go to bed already sleepy. Definitely don't just sit in bed and watch TV. As a matter of fact, I don't recommend having a TV in your bedroom at all because it's really just a distraction. You might have heard it before, but the only 2 things that the bedroom should be used for are sleep and intimacy. Tip number 3 is to be consistent. Maintain a regular sleep schedule in which you go to bed around the same time every day and set an alarm to wake up at around the same time every morning. And it might be tempting, but even if you have the opportunity to, try not to sleep in. Consistency is important because it helps maintain your circadian rhythm. Have you ever heard that term before? The circadian rhythm is a 24-hour biological clock that regulates us being awake and being asleep. And it all goes off of that hormone that I mentioned earlier, melatonin. Now, for folks that do jobs that either require overnight shifts or shifts that change from day to day or week to week, you're likely doing what you got to do in order to earn an income, pay bills, put food on the table, and survive. But just keep in mind that this line of work is not really a good long-term option, because studies do show that folks that do that type of shift work for several years are more likely to die earlier on average. Now, tip number 4 is to avoid cigarettes and alcohol at bedtime. Now, obviously with cigarettes, you should avoid them at all times, but studies also do show that cigarette smoking increases the risk for insomnia. You might be surprised to hear me recommend avoiding alcohol at bedtime because it causes sedation, and for many people, they actually use it to fall asleep at night. However, studies do show that alcohol, even though it can reduce the time it takes you to fall asleep, can actually make your sleep less continuous and more choppy. Plus, when you wake up, you don't feel as rested. Tip number 5 is to exercise at the right time. Exercise has been shown to improve sleep, and you might think it's a good idea to actually exercise right before it's time to go to bed. However, when you exercise, your body makes a lot of chemicals and hormones that can rev your body up, so this might actually backfire and prevent you from falling asleep easily. The recommendation is to exercise at least 4 to 5 hours before bedtime in order to avoid this. However, everybody's different, so you got to find out what works best for you. Tip number 6 is to always discuss your sleep problems with a doctor in order to rule out any other serious conditions that could be causing you to have poor sleep. For example, if you're getting up in the middle of the night multiple times to pee, this could either be due to a prostate problem in the case of middle-aged men, or it can be due to a bladder issue or an infection in men or women, or it can be an early sign of diabetes in some cases. If your legs feel restless and you're having a hard time keeping them still, this could either be due to poor circulation in the legs or even low iron. Certain medications and mental health conditions can do this as well. If you're having problems breathing at night, this could either be due to an issue with your heart or sleep apnea, which is a condition in which you stop breathing for a few seconds at a time during the course of the night and snore very loudly, or it can even be due to asthma, which causes wheezing and coughing during the night. If you don't have a hard time falling asleep, but then you always end up waking up early in the morning, having early morning awakening, this can be an early sign of depression in some cases. And if you have severe pain anywhere in the body that's keeping you up at night, well then this pretty much speaks for itself. Nonetheless, whatever is going on, make sure you discuss it with your doctor so you can rule out any other additional conditions that could be interfering with your ability to sleep. When all else fails, a lot of people are prescribed sleeping aids in order to help them get some rest. The only issue with this though is that a lot of these medications are habit forming, meaning that once you start using them, it's difficult to ever go to sleep ever again without using it. That's why it's very important to make sure you practice these good sleeping habits before having to resort to taking these medications. A commonly used insomnia medication that you might have heard of is Ambien. This medication has helped a lot of folks get some sleep, but it's very habit forming. Another class of medications used for insomnia are benzodiazepines, of which one example is Ativan. This medication can be highly addictive, so I usually recommend that people do not start benzos in order to help them sleep, because it's very difficult to get off of those. When I use medications to treat insomnia, the most common one that I might use is one called trazodone. This is a medication that was originally developed as an antidepressant. However, it can be a good sleeping aid even for people that don't have a history of depression. And the good thing about it is that it's not really habit forming like some of these other medications. I mentioned melatonin is a hormone that our body naturally makes to help us go to sleep, but it's also available in a supplement and can be pretty effective for some people in terms of treating insomnia. Antihistamines like Benadryl in some cases can be effective depending on the patient. Most of these medications are prescription only, but even for the non-prescription medications, it's important to make sure you discuss them with your doctor first before taking them, because they may not be safe or effective for you depending on your medical history. So that's my breakdown on sleep hygiene and insomnia treatment. I hope that for those of you who are struggling to sleep, you can take something away from this video that can help you catch some Z's. For other videos breaking down important medical topics, please click on one of these or subscribe to Trust PCP. Thank you for watching. Peace out and good night.